Memory Care is a program specifically designed for our residents and patients living with Alzheimer's disease and other dementias. And it's person-centered versus task-oriented care. And what I mean by person-centered is oftentimes folks come in, patients and residents come into us and we know what their needs are. But part of memory care is to figure out what their strengths are, their cognitive strengths. And once we do that, it's often to the delight and surprise of family members and loved ones, because they didn't know that their loved one with dementia could still read, could still do so many amazing things with a little bit of facilitation and guidance. So my job was to come in and create a program so that the anxieties would be lessened. The need for PRN medication for behaviors would be lessened, and joy would be increased, as well as, of course, safety. The whole goal for our folks with dementia is, first and foremost, keep them safe, and equally important is to provide for any medical need that they have. But also equally important is to make them happy. Happiness is vital, it's a basic need, and I think a lot of times folks are surprised when they come into our secure unit or when they go to the memory care wing at our other buildings or in skilled. They're really pleasantly surprised, so to speak, because there's a lot of good things happening. People with dementia have the same needs as you and I, and those basic needs of love and belonging still apply. And for our memory care staff, it's a goal every day to leave somebody with a positive feeling. And folks with dementia and Alzheimer's disease have so many strengths. And it's really a privilege to help them find their strengths and help them express themselves, because so much good can be done. When somebody with dementia comes to us and begins their residence here, we wrap around them and help them transition positively so that we can actually get to, again, those strengths that they still retain. And although, again, we're not going to make anybody better in terms of Alzheimer's disease, we definitely surprise and delight the family, because they often will say, well, I didn't know Mom could do that any longer. No one wants to be diagnosed with that. No one wants their loved one to be diagnosed with that. However, I can sit here and provide 100% assurance that if they come to St. Barnabas for support, they will get that and so much more, because we do amazing things here with our folks with Alzheimer's disease and other dementia. So it is not depressing work, it's quite the contrary. It's affirming and sacred. It's sacred work.